Thank you for choosing Advanced Vein Therapy, or as we like to sometimes say, AVT. We hope this video presentation will both educate as well as inform you about the types of treatment you can expect while in our care. Advanced Vein Therapy is owned and operated by Gem State Radiology, a group of radiologists located here in Boise, Idaho. The physicians that perform vein procedures at Advanced Vein Therapy are all board-certified interventional radiologists. This means that they are subspecialty trained physicians who specialize in performing medical procedures that involve the use of imaging equipment, such as X-ray, MRI, CT, and ultrasound, to diagnose and treat disease. Each year, our radiologists perform thousands of procedures at area hospitals as well as at Intermountain Medical Imaging. At AVT, our patients benefit from these physicians' years of experience with image guidance and ultrasound to diagnose and treat vein disease at the source, non-surgically. In addition, the medical staff at AVT are all registered medical sonographers and/or vascular technologists, which means they have earned additional accreditation in vascular anatomy and imaging. Now that we've had a chance to introduce ourselves, let's move on to the reason you are here and talk about veins. Varicose veins can impair your quality of life. Up to 40% of women and 25% of men suffer from symptoms related to varicose veins. Classic symptoms that patients may experience are pain or an aching or throbbing sensation, leg heaviness or fatigue, burning, itching or tingling sensations, swelling, tender areas around the veins, or cramping, especially at night. Left untreated, vein disease is progressive, and there is risk of developing serious complications. As you begin treatment, it's essential that you understand vein disease and the procedures used to correct it.
To begin, arteries carry blood from your heart out to your extremities, delivering oxygen deep into the tissue. Veins then return the deoxygenated blood back to your heart, which pumps blood to the lungs in order to be reoxygenated.
Nearly 75% of the body's blood is found in your lower limbs, or your legs. To return this blood to the heart, your leg veins must work against gravity.
There are three types of veins in the legs. These include deep veins, superficial veins, and perforator veins. In addition, there are two compartments, a deep compartment and a superficial compartment. Deep veins are located in what is referred to as the deep compartment. The arteries and bones of the leg are located in this compartment as well. Valves of the deep veins typically function normally unless an individual has experienced trauma to a leg or has had a clot in the deep veins that has adhered to a valve, damaging the valve directly. While deep veins are assisted in their efforts by muscles, a second type of leg vein has no assisting muscle. Known as superficial veins, these lay just outside the muscle layer, closer to the skin. Superficial veins reside in the superficial compartment and are the veins most commonly responsible for causing varicose veins. The great saphenous vein is the longest vein in the body and starts at the inside of the ankle bone and extends up the inner leg to the level of the groin. The short saphenous vein runs up the middle of the calf like a seam and ends at the crease of the knee. Unlike the valves of the deep veins, the valves of saphenous veins can stop functioning normally, causing what is referred to as saphenous vein reflux, which is when blood flows backwards towards the foot, causing varicose veins. Saphenous vein reflux is treated with a laser ablation procedure. Conversely, perforator veins are typically treated with sclerotherapy unless they are of large caliber. Then it is preferable to use laser ablation. When blood in the saphenous veins flows backward towards the foot, for example during sitting and standing, varicose veins can occur over time. The third type of vein in your legs is known as a perforator vein. There are approximately 150 perforator veins in each leg. These consist of small veins that run transversely and allow communication between your superficial and deep veins.
As a result of venous reflux, there's a pooling of blood, usually at the ankles. This pooling of blood causes pain, heaviness, bulging veins, skin changes, superficial blood clots, and occasionally ulcerations in the leg. Blood collects in your lower veins, causing them to enlarge and become varicose. In this manner, faulty valves high on the leg may cause varicose veins lower down on the mid or lower leg. If your diseased varicose veins cause you to experience symptoms as those mentioned previously, most insurance companies will cover treatment. Risk factors that can contribute to venous insufficiency include heredity, gender, pregnancy, and age. Additional factors that may speed up the development of this disease or make veins worse include prolonged periods of standing, obesity, hormone levels, and physical trauma. Because the procedures performed to treat varicose veins carry with them some element of risk, often insurance companies require that we attempt to treat your symptoms using conservative measures before they will authorize treatment. Conservative measures may include the use of prescription-strength compression hose, elevating your legs routinely, exercising when possible, and taking over-the-counter pain medication as needed for leg pain. A trial of conservative methods to treat your symptoms can last anywhere from 6 to 12 weeks. Once these requirements have been met, we will revisit with you briefly to discuss next steps and request insurance authorization for the agreed-upon treatment plan. Now, let's talk about how to treat your varicose veins. Treatment of your venous insufficiency and varicose veins is done in a stepwise approach that will be discussed during your consultation. The complete course of treatment varies in length and is determined on a patient-by-patient basis, but may be spread over a period of 1 to 3 months. Patients should expect their legs to possibly look and even feel worse during treatment. Often, the externally visible veins are the last to be treated. Initially, the primary sources of reflux are addressed before the visible surface veins are treated. Using a very thorough ultrasound, which can last up to 2 hours, we carefully evaluate the function of your veins. This information allows us to determine the extent of venous disease and plan the optimal course for therapy for your situation. Typically, a combination of treatments are performed to fully treat venous insufficiency. Types of possible varicose vein treatments include endovenous laser thermal ablation, or EVLT, as well as sclerotherapy. These treatments either close or eliminate the culprit veins. You might ask, don't I need my superficial veins?
Venous reflux, or faulty veins, such as the great saphenous or other superficial veins, actually interfere with the normal venous return of blood. Closing or removing these veins improves venous circulation as blood is diverted to normal veins with functional valves. The resulting improvement in venous circulation significantly relieves symptoms and improves appearance.
Do not be surprised if your treatment plan is later adjusted from what was initially prescribed. Venous anatomy is variable. As some sources of reflux are treated, additional unexpected sources may become visible on follow-up examination. Understand that treatment of vein disease is an ongoing process. We will work closely with you to manage your vein disease. In complex situations, the entire treatment process can take several months and often requires significant patience on your part. We are available 24 hours a day to answer questions and assist you through the process. Your satisfaction and treatment success is our first priority. The EVLT ablation procedure is performed in office and takes approximately 2 hours from start to finish.
Oftentimes, a long segment of vein, such as the great saphenous vein, refluxes or becomes faulty. In this case, we can perform a procedure called endovenous laser thermal ablation, or EVLT.
Initially, your leg will be prepped and draped in a sterile fashion to minimize any risk of infection.
The doctor will then give you an injection of a local anesthetic, generally just below the knee. Once that skin is numb, a small needle will be inserted into the vein being treated. With the needle now inside the vein, a small guide wire is threaded through the needle. A small tube called a catheter is then advanced up the wire through the vein until it reaches the appropriate level for treatment. The wire is then removed and a laser fiber is inserted up the catheter with the tip of the laser extending just past the end of the catheter. You will then be given a number of local anesthetic injections. These injections will continue up the leg. As they progress, you may experience some additional discomfort. With your skin now numb, a needle is inserted through the skin and placed just adjacent to the vein being treated. A fluid anesthesia is then administered encircling the vein in order to alleviate discomfort and protect the normal tissues surrounding the vein from the high temperatures that are generated by the laser. The laser is then turned on and is slowly pulled back through the vein. The heat from the ablation device thermally injures the 3 layers of the diseased vein and the vein closes permanently.
Once the ablation procedure is finished, a steri-strip is placed over the entrance incision and a prescription-strength compression stocking is placed on the leg. You will be asked to walk around at least 15 minutes and then you are released to go home. If you are able to arrange to have a driver take you and pick you up from your procedure, we are able to offer a relaxing medication such as Valium or Xanax. Following the procedure, we ask that you stay on a scheduled dose of ibuprofen or Tylenol for a period of 2 weeks. You can resume most daily activity immediately. We want you up and walking as much as possible, at least 15-minute minimum 2 times a day. Immediately following the EVLT procedure, you must wear a prescription-strength compression stocking 36 hours night and day. After this period, you may take the stocking off at night, but you must continue to wear the compression stocking the majority of the day for an additional 2 weeks. At 1 week following the procedure, you will return to the clinic for a follow-up ultrasound to make sure that there have been no complications relating to the procedure and to assess treatment success. You will experience some pain from the ablation procedure, with bruising along the length of the treated vein. This can last for approximately 2 weeks. The pain can be minimized by taking a scheduled dose of acetaminophen or ibuprofen. If you need something stronger, we may prescribe a different pain medication. Sclerotherapy is another procedure performed for treatment of refluxing varicose veins. Foam sclerotherapy is often performed on veins not visible to the naked eye, as well as surface or spider veins. The procedure is often utilized on veins that make too many frequent twists and turns for us to safely use the laser.
Using ultrasound or a special light for guidance, a small needle is inserted into the problematic vein or veins. Once inside the vein, a small amount of medication is then injected. This sclerosing medication is FDA approved and is known to be safe and effective. Once the medication is injected, it fills the space inside the vein, causing irritation and scarring of the vein wall, which ultimately results in vein closure.
Sclerotherapy is also performed as an in-office procedure. As stated, it can be utilized to treat small spider veins of the legs. And like EVLT treatments, patients will be required to wear a prescription-strength compression stocking for 36 hours night and day following the procedure. After that period, you may take off the stocking at night, but you must wear the compression stocking a majority of the day for an additional 2 weeks. There are some potential risks associated with ablation, sclerotherapy, and other vein procedures. Although uncommon, risks include infection, bleeding, deep and superficial vein thrombosis, numbness, blistering, and skin discoloration. Infection risk is minimized by our use of strict sterile technique during procedures. Your risk of deep venous thrombosis, DVT, is less than 1%. The risk is higher for a clot in the deep veins if you have a history of previous DVT, are taking oral contraceptives, hormone replacement therapy, or if you have a known clotting disorder.
Occasionally, patients may form what we call a knuckle clot, which is a small laser-induced thrombosis and is very stable. These clots can extend from the recently treated saphenous vein into the deeper vein. Of these knuckle clots, the vast majority of them resolve spontaneously in about 10 days. However, we will recommend that you take baby aspirin for 10 days should a knuckle clot be detected on your follow-up ultrasound.
Varicose veins can impair your lifestyle. They can slow you down and cause pain and soreness, robbing you of an active lifestyle. With the most modern technologies and innovative treatments available, Advanced Vein Therapy is committed to helping Treasure Valley residents resume their normal lives, free from the pain and discomfort caused by varicose veins. With the help of Advanced Vein Therapy and modern vein disease treatments, you can beat vein disease. We hope this video has helped you understand varicose vein disease and the procedures available to treat it. If you have any further questions, please feel free to ask. You can be assured that you are in good hands with Advanced Vein Therapy.